5.5% is compared to 100 is actually not as high as we think it is. So substance use users are just a fraction. So we're talking about 271 million people in the world that use substances. So that perception of how a lot of people, because we see them on the streets or where we live, so people believe that a lot of people, like majority of people, use substance, but this is not true. It's just about 5.5%, and this we can always find in the UNODC World Drug. I think it's World Drug Report that is being released every year. I think one of these reports, this year's version, should be released today. So going through it, you find out researches have shown that just about 5.5% of people actually use drug. Another myth of drug use is that people believe that men use drug, only men use drug, or men are affected more than women. But this is also a myth. So the actually it has shown that more men are easy. You find more men coming in for treatment for substance use than you find women. But drug actually affects both male and female equally. Okay, so for every 5 substance users, it has been recorded that about one of every 5 substance user is female. So it's female in drug treatment. So when you come into drug treatment, you find out one of every three people is female. One of every 5 come for treatment. So you find more male coming in for treatment. But the truth is, drug affects men and women equally. Although when it comes to dealing with substance use as it regards women, there are a lot of factors to consider. Women are more stigmatized than male when it comes to substance use. So you find people permit a man. So when you come and walk and you see a man smoking, the first thing is, oh, it's a normal thing. But when a woman is found smoking, there's a lot of stigmatization. There is a lot of societal stigma generally that affects women. And of course, because of the nature of the gender, the female gender, childbirth, and a lot of that. So women can have really serious health risk when it has to do with substance use, unlike the male. But when you go to prisons, when you go to you find out that both male and female are actually affected by substance. So it's not gender specific. It's not a gender specific thing, because both male and female use substance, and both male and female, just that women seem to, because of the society still, you find out that the female gender tries to hide the substance use, unlike the male that are more expressive about it. Okay. Also, another myth that we might have about substance use, that people believe that all psychoactive medicines are harmful. All psychoactive medicines. But by psychoactive medicines, I'm talking about drugs that can affect your mood, that can affect your behavior, and can affect your thinking. And we know that these substances that people abuse, that's what makes them addicted to it. And it's the fact that it affects the way people think, affects their behavior. So a drug like cocaine, for example, when you take it, there is this heightened feeling of pleasure, this euphoria that comes with it. And that's it about psychoactive medicines that makes them different from other medicines. Now, some of those drugs are prescribed. Like if we talk about the benzodiazepines, they are used to treat other illnesses. But people then, without prescription, take these drugs and then begin to abuse them. And because most of these drugs are addictive, people get addicted to them, and then it becomes a problem. But ideally, most of these drugs are used for researches, most of these drugs are used to treat status with prescription. Okay. And not using this drug with prescription then becomes, of course, drug abuse. When we say abuse is not using it in an abnormal way, abnormal use. That's what we say when we say abuse. So these drugs usually should come with some form of prescription. Okay. Another thing that we should note about substance use is that sometimes even before a child is born, the child can have can be vulnerable. So we have a group of people that are called the vulnerable group, and these are groups of people like, for example, a child that is born by parents that already use substance. So a mother that uses person becomes like a vulnerable person. Also, there are some environmental factors. There are certain areas we know, some certain communities, even in Nigeria here, that we know that are known for the whole substance use. Let's look at some cultures. So we look at some cultures associated with substance use. So trying not to be specific, but let's look at, let's say in the south areas, we've heard of some communities where it's believed that when you give birth to a child, you need to give this child alcohol or give this child certain drug, and by giving them, it shows that this is the son of the soil. Now, for those group of people, they are literally born into that vulnerability. They are literally born into that environment. And for a typical child or an individual that grew up in that community, you find out that they are more at risk of being substance dependent in future or having the substance use problem just because of exposure to that environment. So a lot of people, and yes, we also have the genetic factors that also play a role in substance use and substance dependence. Then the final one I'll be talking about is the fact that people believe that once you see a substance user, arrest them. Let's arrest them. Let's punish them for using the drug. The truth is, it's more effective for you to send people with substance use into treatment than punishing them. Punishing them would not really change the problem, because addiction, when we talk, addiction is a disease of the brain. It's not, you're not going to solve, so you don't solve it by beating the person or scolding the person or advising. People who are substance dependent needs to be treated just like the way someone who has some physical illness need to go through certain treatments. That's how those in substance that are substance dependent need to also be treated for their substance use problem, because it's a struggle. A lot of substance users have to struggle with it. Like we say that recovery is a lifelong journey. So it's not a one-off thing. It's not a treatment of, oh, let's just advise this person or let's pray for this person and this person will get better. It's a process and it takes a while. Usually it can span throughout the lifetime. So there is never a time that a substance user can, a substance dependent person or an addict can, someone can come and say, "Oh, I am fully recovered from drug," because we believe that it's a process and it's a journey, and this journey takes a long time, and it can actually be treated. Substance use can be treated. Yes, there is a case of relapse that happens in the journey of recovery, but substance use disorders can actually be treated. Okay. Finally, we're talking about overdose deaths. Now, I want to touch a little about that. Now, we are aware that we get it in social media. We hear news of people that had some form of that died as a result of drug overdose. The truth is, most of these overdose deaths can actually be prevented. They can be prevented, and people don't know this sometimes. But the truth is, like for example, going into treatment can actually prevent can actually prevent deaths caused by drug overdose. But when people don't go for treatment, they don't go for detox and all, and of course, because it's an addiction and it's a problem, there's the issue of drug tolerance, and people begin to increase their doses for the substance. It gets to a point where the body can no longer take it anymore, and then there is the shutdown of the whole system and the person dies of the overdose. So these are few myths about substance use. Okay, so as we go on, I hope we'll be able to address some other of this. Okay, thank you.
Thank you so much, Gloria. So thank you so much for that. I am what I'm what so we're going to go into, I'm just going to ask specific questions. Then we can put our questions in the chat as we are doing. forgive my for today because I'm a bit not so familiar, but I'm just working, getting along as I go. These things look easy when somebody else is doing it and you are the one talking. But now that I'm the one doing this, is not so. I'm not very familiar, so please forgive me. But so Gloria, why do people, which is the focus of our conversation, why do people relapse? What are some of the common reasons why people relapse? Some say, so I've heard people say, look, I didn't go into any rehab. Some have gone to like 6 rehabs, 5 rehabs, 10 rehabs, you know. And we, in all fairness, we have had our own share. We've had our own share of people coming to our drug program and they relapse. In fact,
Yeah.
statistics says that most times between 4 to 9 of every 10, 4 to 9. In other words, if you reverse it, will relapse. And if you reverse it, you are saying that 1 to every 4. It's actually 6 to every 9, 6 to every 9, which now reverses to 1 to every 4 will succeed in the long term. So what are the common factors that make people relapse? We have to keep it brief because we have very short time, and
Okay.
so that people can ask their question. Why do people relapse? And what are, as you answer the question, I think you should just also say what can they do to mitigate this issue.
Okay. Okay. So one of the reasons why people relapse is stress. Yes, stress. So there is this thing about when someone is in recovery after a while. So the whole thing seems stressful. So we try to advise people that are in recovery to avoid maybe stressful jobs or stressful situation generally. This could be actually be emotional stress too. So the feeling. So there's this feeling over feeling of being overwhelmed that comes with recovery. So you are recovering and it feels like, oh, so I'm going to stay off this drug forever. Mind you, remember that these people that are in recovery, being in recovery, staying off drugs is not what they are used to. So the typical person that has been using substance for a while is used to this lifestyle of wanting to use drug, just numbing all the feelings of pains and all the feelings of all the negative feelings that might come with it. But now this person is staying off the drug and the person is meant to stay away from drug. So life seems a bit on the edge for them, and then it can come with stress. And mind you, this stress is not only the negative stress. Sometimes it could even be the positive stress of getting promoted getting promotion at work or starting a new
So
job.
so so how would they manage that? Because stress seems to be a
Okay.
part of life. How would they go ahead to
Okay.
manage? So you talked about stress. How would they manage that?
Stress. Yeah, they can talk to someone, really talk to a therapist, talk to your sponsor. So we usually would advise those in recovery to have a sponsor. A sponsor is someone that understands the drug process, the drug program, and will not judge you. Someone you can talk to, you can call at any time and talk to about your drug problem that can help you. So it helps to talk to a sponsor, it helps to talk to a therapist, it helps to talk to a close friend, someone also that really understands that. Also, attending meetings, recovery meetings can help. And very importantly, during recovery, people should avoid major life changes. Major life changes include maybe major relocation or starting a new job, or as much as possible, people should avoid those major changes in life that can come with stress. So stress management really, and talking with a therapist can really help for that. Okay. So another way people can prevent relapse, another cause of relapse really is overconfidence. So there is something we call the honeymoon phase in recovery, where a substance dependent individual, someone with the substance use disorder, has been in treatment for about a month or 2 months. At that point, their body is beginning to normalize, their emotions are beginning to normalize, and you've been off drug for like 2 months. So you begin to have this. honeymoon feeling. We call it honeymoon feeling because there's this confidence. Oh, I'm clean. I'm away from drug. I can cope with it. I think I can do it on my own. I don't need the treatment. We begin to some have this shock, as in you no longer remember how it was when you started, how you had to struggle, because you no longer feel that um those negative feelings you had while you were, of course, the withdrawal symptoms are over and all that. So there is this thing about overconfidence. I can do it on my own. I no longer need treatment. I think I can solve it. And this is a major problem that can lead to relapse. But people need to realize that sometimes you become really overconfident and you begin to have very irrational thoughts. Irrational thoughts are things like, so one of the things that we talk about in recovery, we say stay away from the triggers. So by triggers, we are talking about people, we're talking about places, we're talking about things or time of the day. These are things that you have associated your substance use with in the past. And now you are in recovery. One of the major is stay away from your trigger. So you hear things like people saying, oh, I just wanted to go and see that my friend that we used to smoke together. I just want to go and see that person just to tell him that I'm no more using the drug again. And by the way, these were warnings, these were triggers that you were meant to avoid. But because of that overconfidence, that feeling of, I think I can do it by myself, I think I am okay, I think I am cured, then people now put themselves at risk of a relapse. You must realize that recovery is a journey. You do not get cured. You just manage it. You treat it. You take each step as it comes. And not put yourself in the same situation in triggering situation that can then lead to a relapse. Okay, then the next point is self-pity. We have self-pity. People begin guilty feelings. There's a guilty feeling that can be overwhelming for people in recovery too, where you begin to feel sorry for yourself. Oh, I feel bad that I've done this. I feel bad I've lied to people. Oh, yes, there's that feeling, but a substance user must learn to deal with the feeling of guilt and shame, because this feeling puts you, so there's this thing about feeling guilty. I can't mingle with these people. I feel like I'm not good enough, the low self-esteem. So part of recovery is actually building your self-esteem back, right? But when we leave ourselves, we now stay in that low self-esteem, then also you put yourself in a situation where you feel mistreated. You feel like you're not good enough, really. It's just that feeling of low self-esteem. That's how much I can explain it. And the guilt, feeling of guilt and shame. Then there's the feeling of distrust. Okay, so over time, being in substance. So substance use comes with a lot of negative behaviors like lying, dishonesty, and all that comes with substance use. People in recovery most times find it difficult to to adjust fully because, of course, the people you have hurt before you came into recovery, you've lied to them, you've cheated. There is still this mistrust that is still going on, and it takes a while for you to gain back that same trust that you have lost over time. It usually makes this whole process difficult, but like I always say, that really gaining back the trust of those that you have lost the trust is not going to happen on your term. It's going to happen on their, you're going to be patient enough to wait for them to trust you again. Although we try to involve families in recovery and say, oh, you need to give this person some form of leverage, kind of, but it's going to take a while. And putting yourself in that self pity position can often lead to relapse. Then finally, dishonesty. By dishonesty, we're talking about dishonesty even to yourself. Sometimes people lie to themselves. People lie to themselves about the whole recovery thing. Recovery takes honesty. You need to be sincere. It takes the topmost sense of sincerity. And this is a bit difficult for a lot of people in recovery because it's not what they're used to. So a lot of people are used to lying to get the substance, to live. So now coming back to live a life of honesty might become difficult, but honesty is very important in recovery. If you are not honest about your drug problem. You're not honest to know that this is a weakness for me. This, I can't cope with this. You're not even honest to your therapist. You're not honest in recovery to say, oh, I have a problem and this is how this is what I think, even with the way you feel. Some people are not honest with their feelings. And this dishonesty often can be a challenge in recovery and can push people back to a relapse if not handled properly. So one should learn how to be honest with the way you feel, honest about the drug use, even when you use the drug. So in recovery, there is what we call lapse and there's what we call relapse. A lapse is just a sleep. So someone who is staying off drug for a while can have a sleep. Maybe he used the drug. At that point, it is needed that such individual be honest about it. Oh, I used this drug. This is what happened that led to the use of the drug. This honesty actually helps even your therapist or whoever you're talking to, maybe the sponsor, to know that okay, this is where you missed it, this is where you what went wrong, and this is how you can amend it and do better in this. But whereby such individual just sweeps it up the carpet and is lying about it, then we know that you are gradually warding off back to a relapse situation. Okay, so those are four things I've mentioned now.
Okay, thank you so much, Gloria. So people, the floor is open. If you have questions, you can indicate. You could indicate, unmute your mic. You could ask your questions directly, or you could just put it in the chat. We have within 20 minutes, I will be wrapping up. Thank you so much. So some of the things that are facts is that drug addiction is not just a failure in moral. Anybody
Yeah,
can become addicted to
to a
drugs.
substance.
Um,
Yeah,
you can become addicted to this. You could become addicted as a result of various reasons. I mean, various things can lead you to drugs. So it could start as it could be a good thing, it could be a bad thing, whatever, but addiction really, when it sets in, it literally hijacks your mind. And we need to understand that. So, and when people come into treatment, they need to understand that. And I think one thing I should just answer generally, which is one thing we are looking at in Gracehill. So I'm waiting for us to indicate that we have a question. Or meet yourself, you can ask your question. But one thing we do here at Gracehill, or one thing we constantly try to ask ourselves, it is said the UNODC secretary said that a lot of people who have drug challenges, in fact, he said 1 in 8 who need treatment go into treatment. 1 in 8. That is not so. That means a majority of people who need treatment don't go into treatment, and it's for various reasons. One, they do not even accept that they have a problem. They are, a lot of times they're in denial that the problem exists. And on another reason why some people don't go into treatment is also the challenge of finance. Treatment can be expensive, and because it's not even just a short-term thing, it's a long-term thing. But I always like to encourage people that you need to prioritize treatment, because addiction most times, not all the time, not 100%, but most times does not get better if you don't seek treatment. So, well, I'm waiting for anybody because we don't necessarily have to use the 1 hour if we don't have questions. But if we have questions, let's go ahead and ask our questions. You can unmute yourself, ask your questions, or just put it in the chat. I read the question, and Gloria or myself can respond to it. We're celebrating the World Drugs Day, and the theme is better knowledge for better care. Let's approach this from a place of knowledge. Some people say, "Oh, it's a spiritual thing," and when you see a drug addict, the way they act, and the way they go about what they are going, or you may be there out there listening now and struggling with it, and even you rationally you may know that I don't need to do this, but I can't seem to stop this. It's because there's a chemical, there are activities going on in the background that literally the brain has been hijacked by the drug, and there are certain techniques that when you do them, they will increase your chances of staying drug free. And that's why today we focused on the common things that make people relapse. And Gloria mentioned some of them. One of which I like to always emphasize is overconfidence. When you have stayed off your drug for a while and you begin to feel like, I don't need the group sessions, I don't need the treatment, I don't need to talk to anybody, I don't need anybody anymore. I've done 1 month, I've done 2 months. In fact, someone shared with me recently how he had done several months and just passing the place of where he used to buy drugs mistakenly. Not even intentional. He just passed them mistakenly, and within 24 hours, someone who has gone for months without using, within 24 hours like that. So those are some of the things. Avoid your place. Avoid where it triggers you. Don't become overconfident. Choose to, like Gloria mentioned, be honest. Dishonesty. Honest with how you feel. If you even feel like using, tell somebody, guy, I feel like using. No, doesn't mean you are going to use. And if you use, don't try to cover it. Go and expose it. Tell someone, because addiction thrives in secrecy. I'm still waiting for anyone to comment, contribute, ask a question. I think.
I think someone's hand is raised up.
Okay, sorry. Okay, let me see now. I can't.
Someone's hand is raised up.
You can unmute yourself if your hand is raised and go ahead and ask your question.
Okay, my hand is raised up.
Okay.
I wanted to ask, somebody I know has been on drugs. She's a very, very high functioning lady, but she lost her job, her marriage broke. She's been to rehab a few times.
Okay.
But she's addicted to painkillers. So it started off from when she did a surgery.
Yeah.
But she keeps going back, and now she's injected, her whole thigh has gotten infected. What can we do? Because her family have given up with her. She's lost her job. She's lost everything. So I just encourage her when she talks to me. But I think, what can we do about somebody like that?
Okay, great question. So you said the person is the person still highly functional or used to be highly functional?
No, she used to be highly functional. She's not.
Okay.
She's out of job now.
Yeah. Okay. Well, there are major factors in treatment. One of which is for some addiction, you need to put the person in a controlled environment. A controlled environment just simply means an environment where the person cannot have access to drugs. So, because when addiction sets in, by definition and by the way it plays out, it goes against, it's a compulsive behavior that goes against every form of rational thinking. So, for example, this friend of yours or this person, if you so there are complications that have resulted from the injecting herself, but despite that, she cannot seem to stop. So there's a compulsive behavior. Now, I kind of think I know the drug in particular you may be talking about, because it's quite common. Some people have, it's quite a number of people. Not everybody who does surgery gets hooked to it, but it is used and people get hooked for various reasons. And it's called pentazocine. It's most likely one of the painkillers and all of that. Now, it's notorious. It's notorious. Yes, it's notorious for the ulcers that it creates and all that. So to deal with it, most times, in this side of the world, Nigeria, we often practice abstinence, but in some places they do substitute. So for substitute is that they move from using injectables to using tablets instead. But we don't practice that much here. And so they use things like methadone. It's called opiate substitute treatment, because if the person stops immediately, the withdrawal effect can be really, really upsetting. Very, very upsetting. And that may even be partly why the person can't seem to stop. Because when they try to stop, they experience extreme discomfort. And sometimes the discomfort can even be life-threatening. So the person needs to be in a hospital setting, first to address the withdrawal, which will go the acute phase of withdrawal, which will span between 1 week to 4 weeks, sometimes longer. and then also then go into the program proper. So the person needs to be in a controlled environment for a period. And the second thing too is that the reason for staying in the controlled environment is not just to keep the person away from the drug, is that the human body, the brain in particular, when it has been exposed to drugs and addiction has set in, it literally takes months for the brain to kind of come back to normal. So that period also allows for the brain to heal. So, and then I will finally say this: you need to do a lot of encouraging to get the person into treatment. But sometimes, if the problem is becoming life-threatening, either to the person or the people around, then there is a caveat, or there is a permission in the law that allows you to involuntarily get someone to receive treatment. I mean, they will thank you later. So there is that point. If you've tried, try to encourage. It's always best to try to encourage.
Yes, I tried to encourage her, and she went to rehab in the States. But she went, it was like a day center. So her husband said it didn't work. Then she came back. She was going to different pharmacies to get it. And then it led to problems at work and everything. So I also told her that I knew some addiction specialists. And then the next thing I learned was that she went back on it again. And now we're not even living in the same city anymore. So I just wanted to know, maybe I can even reach out to, can you deal with it in your hospital?
Yeah, we do that.
So maybe I will refer her husband or brother or her family to you, since I have your contact. And I just wanted to make sure I was referring her to the right direction.
Right place. Okay.
Thank you very much.
My pleasure.
So
Is that okay? Okay. Who else has a question? We have barely less than 10 minutes. And final words from Gloria. So someone saying something, I can't hear.
I'm following you up, and I really appreciate your address. Speaking Moses, I'm speaking from Saudi Arabia.
Okay, wow. Oh, wow, my chief.
Can you hear me?
Yes, much better now. It's much better now.
Yeah, how you doing? I appreciate the work that you guys are doing, and some of the patients I refer to you, they are doing very well, and they always tell me of the outcome concerning the drug addiction. Is a big challenge. As an anesthetist, we've had patients, especially sickle cell patients, that get hooked up on some of this pain relief. And those that have arthritis, they want to be on pain relief constantly. And we have challenges winning them off these drugs. And, there have to be an interplay with psychological and environmental manipulation to get them out of it. My question is depression. Depression is one of the challenge we have with those that are hooked with these drugs. How do we handle them? Because it can be suicidal at times, and they can take their lives. Some of the cases I've seen some patients, you just hear that they die suddenly. Some of them are drug addicts, and they get frustrated. They cannot sleep without taking the drug, so they take their life. So how do you handle such a situation so that because the rate of suicide is becoming so high in our environment too?
Okay. Thank you so much.
Thank you, Edebi.
Thank you, Dr. Kute. Thank you so much. So, Gloria, maybe you should just answer, and then we'll begin to round up. So the question is, depression along with substance abuse, how do you, and sometimes that is like a maintaining factor. The person is struggling with substance abuse, but also struggling with depression. And sometimes the drug is even what they use to address that. And then he also mentioned, he didn't ask it, but he said sometimes patients are struggling with their sleep. They just want to sleep. And this drug helps them to sleep when they don't take. So how do you handle that? Briefly, please, because we have 6 minutes to go.
Okay. Okay. So for depression and substance use, the thing is, it's kind of intertwined. Depression and substance use. A lot of people believe that they use the substance to cope with depression. Actually, it could actually be that it's even the substance itself that is making them to be depressed. So it's kind of intertwined. Now, using drugs like some of these drugs like stimulants. Now, you're high, so we have a level of neurotransmitters that our body needs to function. So most of this psychoactive substance increases these levels to a very high height. Let's say dopamine, for example. Dopamine has been increased to a very high level, and then when the person is coming down, usually comes down with a crash. So part of the withdrawals of some of this substance is the depression, the feeling of depression. And so in order to maintain this level of sanity, they have to go back to the drug. So it's now like a cycle. So they take the drug, they feel okay, they get depressed again, they go back to the substance use. So rehabilitation really is what such individual needs. Such individual needs to have some form of detox and let the body, allow the brain to actually heal and come back to normal functioning. That way we can say, oh, this is it. The person is actually getting improvement. But as long as that person is in that substance, it might be difficult to actually treat because this depression might actually be caused by the substance this person is using. So such individual needs to be in therapy. Yes.
Okay. Thank you so much, Gloria. Thank you. Because of our time, we need to round up now. What monthly this comes up. So so for those patients, in addition to what Gloria has said, is that sometimes you need to put some patients on antidepressants. Sometimes you need to give them medications to help them sleep. And one thing we often advise is that it may not give you the type of sleep that your drug of abuse gives to you, but it will help you sleep. Because there's a kind of peaceful sleep that most drug of abuse will give, but it also slows down the heart rate, slows down every breathing, and that's why some people just sleep from there and die and just overdose. So there is medication management, but there's also psychotherapy, very important. Some people often think that treatment is just about medication. Doctor, I just want to come do detox, just give me one drug that will help me, that will not make me take this drug again. You know, it's not just that. You need to go through therapy so that certain things will be taught to you, triggers and all of that. I will continue this conversation, but we'll have to end now. But if you look at the chat, you would see our Telegram community. It's called the Gracehill community. Just click on it on Telegram. Join us this particular month. We're talking about the truth about drugs, and we will continue the conversation. Because of the peculiarity, okay, one more hand. Is that a hand up or a clap? I don't get now. But we have to round up. So we'll continue this conversation on our Telegram, and then we will have this once a month. And not only on drugs, we will have conversations, you know, on various mental health issues. And that's so we will appreciate if you spread the word, and we keep talking about mental health. Knowledge is power. Knowledge is power. You know, people often do what they think will help, even though it is not informed. It's not an informed decision. Thank you so much. We also have an NGO. It's called the Gracehill Healthy Minds. And that's an attempt to work with the UNODC to kind of address the drug abuse problem. But we're on it. It's a challenge. It's a collective problem. It's something that we can all inform ourselves. Dr. Paul, you can go ahead, just quickly, 1 second, 1 minute. Dr. Paul, you can ask your question.
Okay, I was actually giving a clap.
Okay. Okay, thank you so much. Thank you. Okay. Thank you so much, everyone. Thank you for joining in. Join the community. Thank you so much. Bye-bye. God bless you. Have a wonderful weekend. Have a wonderful day. Spread the word. You know, let's be informed. The hashtag is hashtag facts for solidarity. So let's be our brother's keeper. Let's not condemn those who have drug issues. Let's be informed. Let's talk to them. Thank you. Bye-bye, everyone.
Thank you. Thank you, Doc.
Thank you, Gloria. Thank you, Gloria. Thank you.
Thank you.